Okay, so hello and welcome. My name is Chelsea Grover. I'm the Marketing Communications Coordinator for Attentive Healthcare Solution, and welcome to our webinar today. I just do want to announce that the webinar will be recorded, and we will be making copies of this recording available for you later. So a little bit of who we are with you. We've been in business as Attentive since 2003, but we've been NextGen users since 1997, EPM version 2.3. We do everything NextGen. We specialize in it specifically. We know how to get data into, out of, and around it to get our clients the information that they need to do what you do best. We also have two NextGen add-on solutions, ChartGuard and Refund Manager. So coming up, we have some upcoming webinars. The first one is going to be on February 1st, and it's What to Expect When You're Testing, a survival guide to meaningful use at a station. In this webinar, we're going to provide you with detailed instructions on how to attest and what you can expect while attesting. And then on March 15th, we're going to have today's electronic data interchange, so much more than claims. In that webinar, we're going to explore today's EDI capabilities, including appointment reminders, statements, collections, patient satisfaction surveys, real-time scheduling, patient outreach, population health integration, and so much more. So we hope to see you at both of those. You can either register for them on our website right now on our Events and Education page, or you can wait until we send out the webinar invites, which is traditionally a week before the webinar. Either way, we hope to see you there. Okay, so back to today's webinar. I want to announce that we're going to take questions at the end, but you can type them in the webinar control panel whenever they occur to you, and we'll go through them in the order that they're received. Okay, so without further delay, our presenters for today are Lindsay Lanning, Healthcare Compliance Consultant, Cindy Kincaid, Vice President of Consulting Services, and Adam Boron is also going to be available to help with questions at the end. Adam has been fully immersed in 8311 due to his recent involvement with the NextGen Data Project, so he should be a great resource for your questions. Okay, Lindsay, so I'm going to go ahead and hand it off to you. Please feel free to get started when you're ready.
Great, thank you, Chelsea. Hi, everyone, and thank you for joining us today for our webinar, Features of NextGen KBM 8311 and 58UD3, What are you waiting for? So as the healthcare landscape continues to experience major changes, it's important we stay up to date with the new features and functionality of our EHR system to make caring for patients and meeting those stringent regulatory requirements possible. So we want to make sure our provider partners are aware of the latest and greatest enhancements and added functionality to make their jobs easier. So stay with us throughout this webinar today as there's a lot of information to get through, but don't worry, as Chelsea said, we will be making a copy of the presentation available. In today's webinar, we're going to start by providing a summary of new features in NextGen ambulatory products for 58UD3, beginning with practice management changes and updates, and then moving on to the EHR side of things, looking at enhancements for encounter documentation and added functionality for increased efficiency. We will then look at changes 58UD3 had in regards to the NextGen patient portal, including enrollment status and increased integration with both PM and EHR. We will also cover KBM 8311 changes by specialty, highlighting modifications that will benefit provider documentation. And finally, we will briefly look at the upgrade process and provide recommendations for best practices when upgrading your own system. So let's get started. We're all aware both 58UD3 and KBM 8311 are in general release. 58UD3 was announced on October 28th, and KBM 8311 was officially available on November 6th. So these are fairly new upgrades, and we're extremely excited to show you some of our favorite features found within these new versions. NextGen seems as equally as excited about these releases as they describe the advantages to upgrading and different reasons why users should consider making the change, citing things such as enhanced patient engagement and integrated care guidelines, streamlined workflow for an improved patient experience, new specialties, enhancements, and an improved MyPlan, and better product development process. And then finally, summing it up in just a few words, new versions, better workflows. So let's get started by looking at these new versions and better workflows with 58UD3 practice management. We'll begin by looking at basic changes that were made to the practice management toolbar. There are added buttons for an easier pathway to NextPen, the BBP, and NextGen Clearinghouse. So for clients who are licensed for NextPen and NextPen Print, you will now have access to those applications from this main toolbar. The same for the background business processor. And then all three of these can also be accessed directly from the task menu. I also mentioned access to the NextGen Clearinghouse. Well, we now have toolbar single sign-on for the NextGen Clearinghouse right from PM, which means you no longer have to go out to the application launcher. You will have access from within the application itself without needing to enter login credentials. But please note this does need to be enabled in System Admin. Moving on to a new feature for PM is the Patient Information Bar. Prior to 5.883, the Patient Information Bar was only available in EHR. The application has been enhanced to allow for configuration and display of a Patient Information Bar in practice management. This will provide users with quick access to valuable information when working in charge entry, payment entry, or the patient chart. It provides information at a glance and also allows the user to easily access appointments, which you can actually now hover over to see up to 4 historical or future appointments, insurance, patient balance, recalls, eligibility, and tasks. And then the patient information bar for practice management is enabled and configured in practice preferences on the patient information bar PM tab. New to the Add Appointment window is the inclusion of care guidelines. Display is optional, which you can set up in practice preferences. Also in practice preferences, you can control guidelines to appear that are due in X amount of days. The reason for doing this is to allow schedulers to incorporate scheduling for additional services so that users can view a patient's upcoming or overdue clinical care items. Next, we have optical character recognition. This functionality has been added to the application to simplify the process of registering patients and entering insurance information. Now, when you're scanning a license or insurance card, the information is automatically collected and then populated in the database field during appointment check-in. So information such as first and last name, your address, city, state, and zip, and date of birth can all be imported into the patient demographic record when you're scanning a driver's license. And then the policy expiration date or policy number and group name and number can be imported into the patient's insurance record when scanning an insurance card. Now, I do want to point out important information that differs from current information will be highlighted in yellow. And you can choose to either accept the new information or not to. And this is what you're seeing in that screen grab on the right. Keep in mind, when a card is scanned, the data returned will be exactly as indicated on the card. So, for example, if a license text is in all uppercase, the text imported will also be in all uppercase. So case differences between current and new data will be reported on the Confirm Changes window as an entry eligible for update, which is the case with, again, this screen grab on the right. Here you can see what scanning an insurance card or license would look like, and then pressing OK to capture the information that would then be included in the insurance or demographic section for that patient. Moving on to recall plans. The recall feature in PM has seen several updates in an effort to improve usability. New features include allowing users to edit existing recall plans, place multiple patients on a recall plan, and track recall plan stop reasons. A new field was added that shows the last performance date. A push pin notification icon was added on the appointment screen to indicate an active recall plan. An updated recall plan alert to show name and due date of a recall. And a brand new alert for expired patients on an active recall plan. So if we take a closer look at these features, let's start at the top and then work our way down. You can see in that first screenshot the added push pin notification icon to alert the front desk this patient is on a recall plan. Next, we can see where the last performed date is displayed, showing when the event was last performed, which provides more accurate scheduling for patient treatment. And then finally, here's an example of the alert for expired patients. So when a patient is flagged as expired, a warning message will now display, alerting the user that an active recall plan exists for the patient or if future appointments exist for that patient. So currently in EHR, users can work tasks for multiple practices. In PM, with this upgrade, it will now allow the same feature. Users can work tasks for multiple practices at one time. We're going to see a lot of the features currently in the EHR that are coming to the PM, since they've proven to be so beneficial for users. So if we look at Work Log Manager specifically, we already mentioned the enterprise work log, where users can now work from tasks from any practice within the enterprise they have rights to. But there are other new features as well, including the ability to save search parameters for future use, and that will automatically populate search fields. Users no longer have to reselect search options over and over again. They're saved and can be recalled from a drop-down list. There are also added filters in the General tab. These provide users with more search criteria and includes an improved Advanced tab. And lastly, new user preferences. This upgrade enhanced tasking user preferences for preferred task types and column display, basically allowing users to choose which task types display in the Work Log Manager. We can continue on by looking at enhanced forms. PM now utilizes a new form builder that allows users greater formatting options, such as copy and paste, the use of various fonts, and viewer insert. Users also now have the option to bring in documents from external sources, i.e. the internet, into your form. This allows users to create custom fee tickets. This means you don't need an Excel license to create a fee ticket. Archive an actual copy of the form or letter. Forms are now archived like statements in the patient chart and account. This includes forms that have an e-signature, so no more having to store paper copies just for keeping that signature. And then finally, set up and print groups of forms and view an image of letters that have been sent to the patient. So if we take a look at the enhanced form, you can see all the different options now available to the user. Switching gears a bit here and looking at credit card processing. Integrated credit card processing functionality allows for greater security and more options when collecting payment. New features include a token ID to store patient credit cards, which is actually stored in their account and can be utilized for patient credit card transactions that require that card information. Print credit card receipts directly from the transaction entry screen. Collect signatures via ePad, and process credit card payments for encounters in bad debt status. We can see this added functionality in the charge entry screen with the added options for CC Pay and CC Processing Receipt. Looking at statements, collecting money from your patients is becoming increasingly more important as patients become a bigger and bigger source of where your revenue is coming from. So to ensure collections efficiency, new options have been added to the practice preferences that include the ability to apply dunning messages based on statement counter, which means these messages can now trigger from the number of statements sent to the patient or from the age of the balance. And multi-page statements without the header and footer showing on every page. This information now displays only on the front page and the last page of multi-page statements. The real-time transaction server. So with the help of the new interface, RTS eligibility requests and responses will see some enhancements, allowing users to verify eligibility for payers that have not been added to the patient chart, submit eligibility transactions for multiple payers in real time, and view claim status responses directly from the patient's chart. Also, the need to manually add every payer during setup has been eliminated. So I know our PM specialist was extremely excited about verifying eligibility for payers not associated to the chart. That happens all the time, and currently we can only verify it if we put it in the chart, but this will actually allow users to check their eligibility across the board, which is pretty awesome as he described it. If we look at the ERA, the system can now create an EOB for manual payments that users can view that utilizes the same functionality available for ERA payments that are manually added and manually posted insurance payments. This also provides practices access to a complete EOB after posting payments that did not post in the ERA process, as well as manually posted insurance payments that can be used to review discrepancies and also to send with paper non-primary claims. So the ERA now has the ability to display transactions manually added to the ERA generator batch. and users have quick access to view an EOB and don't have to search for paper copies or scan one into Document Manager. NDC codes. New features now allow users to search and assign the correct NDC code for entered charges more efficiently. Specifically, users can sort columns in the NDC library, add NDC codes in the charge entry screen, which are then saved in the NDC library for future use, and track changes made to the NDC code in the charge entry screen through new significant events and advanced audits. So here you can see how a user can add an NDC code to the NDC library in charge entry just by typing in the number and description. The user can then either add the code if it was not found in the library or view the library to locate a different code. Unapplied credits. Prior to 5.8 UD3, unapplied payments or copays that were not applied during entry of charges needed to be applied individually at the chart level for each patient. But now there's a new feature that automates the process of applying multiple encounter unapplied credits without having to navigate to each patient's chart. This auto-applies copays in a batch mode. Some new reporting options are available with this upgrade, including a new information tab with the top 10 most utilized reports within NextGen KBM that explains the report's purpose and provides examples, additional columns on the AR analysis report, and an enhanced claim production status report to include relevant claim information to reduce the need to open up the encounter to view additional information. We can see here the new columns that have been added to the receivable analysis report by age, month, and type. We can also see that several reports have been updated with that new info button that will give users more detail on the report they're running. And the information will look like this second screenshot showing the logic, filtering info, and then common uses. Consolidated services claim. This new feature allows for consolidating charges from all same-day patient encounters onto a single claim that is then submitted to the payer. The reason why this feature was added was to be in compliance with new rules from Medicare Part A and New York Medicaid that were finalized and require SQHCs to bill same-day patient services on a single consolidated claim. So this may benefit you depending on if you're affected by those rules. Otherwise, it's a feature you may or may not use. And then finally, some other miscellaneous features and enhancements we thought were worth mentioning are file maintenance payer master updates. Practices can now update payer name or expiration date for multiple patients at one time directly from file maintenance. Track preference changes. You can now view changes made to enterprise and practice preferences using the advanced audit tool. Patient merge exemption. A patient merge exemption checkbox has been added to exclude patients who have been confirmed as different people. And it will exclude them from that duplicate persons report and notify users they can't be merged. Restrict users from viewing patient information. You can now actually limit users from viewing or accessing restricted patient records from different lookup screens in NextGen KBM. Automated process for small balance write-offs. This is new. An auto worker will actually consider the entire account by adding up all the encounters to determine if a write-off qualifies. This means users can write off debits and credits at the account level and write off credits at the encounter level. There's also this new search option. This new tool allows users to search and navigate within NextGen KBM and file maintenance. You would just need to click Control-Alt-F to search. And then lastly, enhanced phone number search. Prior to 5.8 UD3, a lookup using a telephone number would return results only if the number being searched was entered into the home phone field. As of 5.8 UD3, the system will search all 5 telephone number fields and return records with a match found in any one of those fields. So that concludes our PM features incorporated into this upgrade. Let's now take a look at the EHR side of things, and I will be passing it off to Cindy Kincaid for this portion. Cindy, whenever you're ready.
Okay, thank you, Lindsay. Well, as we are excited about PM, and I think some of the features in PM I could just have jumped in several times and talk about how wonderful they are, particularly some of the things that we've been waiting on for a long time for those of us who've worked with NextGen for years. I'm really happy to see some of those introduced. And the same applies to the 5.8 UD3 EHR. So as we move forward, we're equally excited about the changes that are being made. And the first area we're going to talk about is probably the most dramatic. For those of you who are on the webinar that is not on UD2, you may not have seen any of the inbox improvements, but the inbox has changed a great deal in UD2, and they've further improved it in UD3. So numerous features now allow for increased efficiency from the inbox. The user can now see the number of unopened tasks, PAQ items, and portal messages. That was something that in the last change they did not employ, and it made it a little harder to see the number of messages that you had or tasks that you were waiting on. This has resolved that issue. There are more options to hover over certain buttons and see more information, such as lab results or appointment information. You can also view future appointments and wait time after check-in by hovering on the appointments badge. The user can now attach an HIE document or a document that's not part of an encounter to a task from the inbox. So as we move forward and take a look at the screenshots, what you will see is that you'll now see at the top the clinical tasking, appointments, and provider approval queue and patient portal are now all accessible from the workflow or the inbox. This was implemented in UD2. However, what we did not see was the 21 open clinical tasks. In this particular case, there's 0 new appointments, there's nothing waiting in the provider approval queue, and in the patient portal, there's 153 messages. Those are all items that need to be addressed, and it was a little bit hard to see. They've now improved that and taken care of it. You also have the ability to see the badges in the bottom right-hand corner with alerts, appointments, allergies, problems, diagnosis, medications, and lab results. By hovering over those badges, you can now see those in a display grid. And as we move through, this gives you an example of how that display grid might display. You can see that they've added the HIE document, and then at the bottom, when hovering over the appointments, you can see the open appointments that the patient has with the appointment date, the resource, and the location. And that's just an example. All of the hover buttons work that way. This is just the new ones that we're displaying today. Moving to the patient information bar, new enhancements have been added to include a patient portal icon that replaces the NextMD icon, which shows enrollment status and provides access to the patient portal management window. A new lab results link to provide quicker access to lab and radiology test results. There's a new appointments badge display that shows the number of future appointments that the patient has, and when the user hovers over this, it shows the date, the provider, and the reason. The ability to hover over contact and all badges to show full detail, and the ability to configure these badge buttons in the order and preference that you would like in your office. The benefits of these hovering is obviously NextGen is really on a campaign to reduce the number of clicks. And anytime you can hover and see something, it just saves you keystrokes from having to open the chart. Some of these were already here, and again, in UD2, they started implementing this capability, and you now see that they've added it to PM as well. This is something that makes it very easy to move about and take a look at your patient's information without having to take that extra click to fully open the chart. Moving on to NextGen Care, there have been a number of improvements that have been made to NextGen Care, including the ability to import a patient cohort from an Excel spreadsheet. To add patients to the cohort or your patient list or campaigns on the fly in EHR, add an alert to the chart of every patient in a cohort, and send patient education to an entire cohort group, or again, a list of patients that you want to communicate with. You can now also print the care guideline gaps in care for a single patient or for an entire cohort. Looking at enhanced orders functionality, this is an area that I'm particularly excited about because I've been working with clients that were very excited about working with this and incorporating what we call closing the loop, and you'll hear me use that term as we go through this. When you're processing orders, the users can now send lab results directly to NextGen Patient Portal through the workflow. You were able to do that through a number of steps, and you could go down and put in some rules engines and things, but it was a lot of clicks and it wasn't really able to do it. Then of course with the CCDA, the lab results are sent there automatically with certain types of rules. This allows you to be able to send it with a note directly from the PAQ when you're placing the order, or any of the other places, so you'll see that as we go through. You now have the option to configure required order module fields. That way you do not have to remember what is required and what is not. We do have a screenshot of that because you can't always remember what you need to do, particularly those ask at order entry. The big thing here is you can track the life cycle of an order. You can track from the time you enter it, from the time it is placed, from the time the results are received, and there are reports and capabilities to now let you close that loop. You can also designate non-providers with the ability to view confidential lab results. And finally, in the second section, which coming back to closing the loops, users can also close the loop now with greater ease because incoming results and consults can be matched with open orders for the current patient. So when you're getting results and consults that are coming in, you know, consults in particular, if you're scanning them or things, depending upon where you're at in the chart, or if you're in ICS, or if you are actually in PAQ and you're approving those, you can actually link them to an open order that was entered and maybe it's not and wasn't closed with an interface. So this is, again, something very, very, I would say, long overdue in terms of being able to track and manage your patient care. An example of sending lab results to the patient portal, you now have a checkbox that's sitting there and you can see it, it's highlighted that you simply have to check to send the results to the patient portal, and you can put in a note and send a note to the patient and they can pick those up individually in the portal. Configuring the required order entry fields, as I mentioned, you can't always remember these, so you can now put in the mandatory data points, and you can make copies, you can put in the points corrected, and it works just like many of the other areas. You can see them in your field on the left, and you can just pick and choose and move them to the right, and that can make them required at the time of order entry. When we look further at the enhanced order management template functionality, on the order management template, users can now filter by lab and radiology test descriptions. You can filter by overdue orders, and you can select an order and access the patient's chart directly. So this is just added capabilities when you're looking at the orders and you're in the order module trying to follow up on these things. You now have the ability to filter and narrow, and again, making it easier to follow up and determine where you're at and where that order stands in the process. We also now have enhanced immunization functionality, and for those of you who are using the immunization module within NextGen, there are some added features to this that I think are going to be very exciting. First of all, you now have the ability to reconcile a patient's immunization data, current registry data, and existing immunization data. What this means is that even if you didn't see the patient or provide that immunization in your practice, you can now go out in your immunization protocols or in your immunization registries, pull down the information and reconcile them, much like you can reconciling your medications, and bring that into the patient's chart. This really makes it now that you've got communication both ways, not only to the immunization registry, but from the immunization registry back to NextGen. You now have the ability to create custom names for vaccines that can be used for displays and searches, making them easier to find. And you can generate a vaccine inventory master file report, and we all know there's been some limitations associated with that in the past. Taking a look at the create custom vaccine names, you can see now that you have the CPT, the CVX, the custom name. You can create the friendly name, the CPT name, and the CVX name. So all of these can be put in a grid, and you can put your custom name in and link that to the friendly name, and that way you will be able to find them and search for them a little bit easier. Moving on to the medication module. In the medication module, users can now select customized denial reasons when responding to a prescription refill. You were limited to basically denied, and now you can put reasons as to why you are denying that if you are not going to renew. Maybe you want the patient to come back in. Maybe you have some other options that you could send. So this is really something that I think has been requested quite a bit, at least with users I've worked with. You now have the ability, which this may not seem like a big deal, but it is, you now have the ability to cancel an e-prescription right from the EHR without making a call to the pharmacy. When you move into reporting in EHR, there are quite a few new reporting features, but among them I think are going to be very helpful are more visual. You now have the ability to have alternate shading of patient data. So when you look at these reports and you see them, you can see that in a patient, and you look at the screenshot, you can see that it's white, gray between patients, and that gives you the ability to immediately distinguish what you're looking at patient by patient. You now have an immunization summary report based on the CDC schedule. There's an open telephone call report. There's a lab requisition crystal report, and dual diagnosis subcoding report. other miscellaneous features that we have in UD3 EHR is the telephone call component, which allows users to customize default call types. Now, the telephone component was introduced in UD2. Again, some of you are probably not on UD2, so some of this may look a little bit new to you. They've expanded on it, enhanced it, and this is becoming a much more prominent feature in being able to do this. The other thing that you can do is you can change your view categories, which allows users with permission, and that's really important to give permission because this scared a lot of people, but if the user has permission, they can actually change the view category to change the items on the categories tab. And you used to have, that was a pretty complicated process. You now have the ability to do that, and that was also heavily requested in terms of feature functionality and making things easier to use. As we look at the NextGen patient portal, many of the clients that I have that are preparing to upgrade to UD3, and we have quite a few, this is being received very, very quickly and very fast, and they're all in various stages of testing because, as I said, it's only come out a little while ago. One of the main reasons they want to upgrade is because of the patient portal. So if we move forward, you can see that the patient portal now includes out-of-office delegates that will enable you to determine who can look at the portal when someone is out of the office. The lab results are integrated, as we demonstrated before. Statements and payments have been greatly improved. You can now post a payment over multiple statements, and you can post those payments even if the statement has not been sent yet, as long as it's in the system. The other thing that has been greatly enhanced is when they post a payment and the patient puts it in there, the balance is updated immediately, even though the batch has not been closed yet. Now that allows them to give a more realistic and accurate portrayal of what their balance is at the time. You now have demographic synchronization from PM, so if an address is changed within the NextGen PM, or in some cases EHR, not many groups allow changes on the EHR side of the house, but at any time a demographic is changed, it will now synchronize that to the portal. The manual CCDA push to the NextGen portal. Currently, you had the ability to send CCDAs in a different area, or the patient had to request it. You now have the ability to just push it when you need to do that. And then we have some improved enrollment management response fields and status icons. So they have now basically made the new icons for the portal, giving you display of the patient status. That was all that we had for UD3, although there are many more functionality. And before we move on to KBM 8311, as most of you know, or some of you know on the call, Itentive was a beta client for 8311. One of our largest clients actually went through the beta process and was on the advisory committee for women's health. And I have to say that when we upgraded them and moved this into production, this was one of the best upgrades that we've ever experienced. There were very minimal challenges. NextGen was very attentive. We have not had a lot of hot fixes or changes that have had to be made. We have not had reports of problems or break fixes that have needed to be corrected, and the client was so pleased that we are now immediately testing them to put them on UD3. And to move that forward, they literally just went live right before it was put into general release, and to be ready to go and move to the next release that quickly after an upgrade, I think lends itself to show how much better and improved these upgrade processes are. So let's go on to some of the functions in KBM 8311. As I mentioned, our client was on an advisory committee. NextGen had multiple advisory committees for all of the various specialties that were working with KBM 8311, and they selected specific areas. The first one we're going to talk about is behavioral health. There are new functionality and templates within behavioral health that for agencies to document services provided in a residential treatment center. The residential services visit type, the residential administration template, and the residential bed board practice template. It now meets DSM-5 criteria. The brief assessment template changes have been made, and there's a shift note template set. In cardiology, the cardiology functionality was enhanced a great deal. Now, cardiology was also impacted in KBM 8310. And I know that there were a lot of areas and groups we worked with that there were continued improvements and enhancements wanted. One of the things that they've done is they've updated the procedure templates. These have been updated for certification and interface standards. They now work with registry data for availability on a single template with the American College of Cardiology Pinnacle Registry. They have improved and increased the appointment integration with doctor's visits, labs, procedure order templates, allow accessing scheduled appointments from the NextGen practice management system. And for those of you, I don't know if we have any groups that are using the cardiology templates on the call, this is almost like a module unto itself. And by increasing this integration, it makes the flow much more smooth. In the workflow, they've updated the cardiology procedure summary section to allow for the display of data grid in reverse conical order. That was also highly requested from the group. And a new filter allows provider names to be viewed in a group. In dermatology, this is one of the areas that I think is the most exciting from everyone, because I'm going to talk about a function called image-driven charting when we get through this. It's the first new feature we're going to discuss with the new features and streamlined workflow that they've incorporated for dermatology. The image-driven charting is ability to chart based on an image, and it's a technology that NextGen has incorporated into dermatology, and they're looking at other areas where this functionality can be used. And in theory, it can be used in any specialty if you want to take the technology and create the customization. I believe NextGen's plans as they move forward, particularly going into KBM 8.3, KBM 8.4, I'm getting my acronyms mixed up, KBM 8.4, you're going to see more and more of it, but for now we're starting to play with it and looking at possibilities of how this could be used in other areas, particularly OB-GYN, pediatrics, any place that you're looking at and where that you might be able to document from an image. They actually have they've added a cosmetic injectable template and a biopsy log. So if we move on to the screenshot, you'll see that this is an example of the cosmetic injectable template, which is also using this image-driven technology. And again, you would simply go in and document where the injection was occurred by clicking on the points of the image, and it creates the documentation for you. And it's really pretty sophisticated technology. And I know for anyone that was at LCUG, the Large Client User Group, or at any of the meetings where NextGen has presented this, they're very excited about this technology and are considering it even in some of their ASC applications. Ophthalmology is another specialty that had a lot of enhancements made to it and had a very, very wide involvement from their advisory committee. The following improvements have been incorporated. There's a contact lens exam. Document all activities involved in fitting and dispensing contact lenses to patients. The providers can review and document the reason for visit, contact lens experience, history of prescriptions, current contact lens prescriptions, and final lenses, and record patient instructions. There is now a post-op exam template that has been modified, and they've incorporated the closed-loop order functionality. The reason this is listed as a separate bullet is ophthalmology, as with cardiology, can sometimes be almost a separate and distinct module. And so they've incorporated that closed-loop order functionality within the KBM associated with ophthalmology as well. Take a look at the contact lens evaluation. It's now largely a single screen. The real general consistency with both of these upgrades, UD3 and 8.3.11, is click reduction. Know all of your providers complain about the clicks and the time it takes to do this documentation. They are now really working on doing single click to do an awful lot of data entry, and they've achieved it with the contact lens evaluation by a single screen. Pediatrics is another area that I have had some individuals say that the real reason for going for KBM 8.3.11 is simply because of the changes in functionality they made to some of the templates within pediatrics. A couple of these enhancements are the Survey of Well-Being of Young Children, the SWYC template update. So they've updated that to incorporate more associated with the regulations and the surveys that are being taken on documenting for children. The biggest one that I've heard the greatest feedback on is the Well Child soap. They now have a Well Child that you can document on a single page with significantly fewer clicks without having to move from one area to another. So there were a lot of movement back and forth that you would need to do here, you would need to go here, you would have to go to the vitals, and everything was jumping from template to template. They now have a single Well Child soap, and that was really applauded at UGM. They've incorporated further growth data and social histories as well, and all of those are improvements to the pediatric template. Orthopedics, changes have been made to the orthopedic template set that have been made to more accurately reflect an orthopedic patient encounter. And specifically, they conducted a complete redesign of the fracture casting strapping templates. This is released in this version, and it is the #2 reason that individuals see in orthopedics. So it was the most used template, and with their advisory committee, this was to them the most important thing that could have been incorporated. One of the things that we experienced by being part of the advisory committee is that when you're talking to them and you're working with them, providers make the decision. They vote on the priorities, and they come to understand that while you can't do a complete overhaul of everything, you can actually be able to affect change by participating, and then you have your voice heard. I can also tell you from personal experience there's a lot of disagreements that go on those. So to get these things out, I think NextGen is again further demonstrating how hard they're trying to incorporate changes that you have asked for each day. This is just an example of that fracture casting strapping template. And again, single page, scroll down, and you can do that. And just again, kind of going back to that, it's just basically streamlining, simplifying, and reducing the clicks. Women's health is the one that we're probably at iTentive most familiar with in terms of our personal experience with KBM A311, although we have incorporated several groups since the time we went to production with this one. The new features and enhancements related to women's health include the OB-GYN synopsis template, the abnormal path HPI template, the OB Post-Partum Visit template was expanded on. That actually was incorporated a little bit in KBM 8310. It has now been expanded and improved. The Parity Auto-Calculation and the Family Planning HPI. Those were the templates that were impacted the most with this upgrade, and we'll go through and talk a little bit about each of those as we move forward. So if we look at the Parity Auto-Calculation, this is an area that has probably been one of the biggest challenges with NextGen, and frankly my experience with any system is how do you calculate the G's and P's? With the update, the G's and P's will now auto-calculate based on your documentation. That was not something that happened before. You could document it in past medical history, and you could document it at the time you're documenting the pregnancy, and they wouldn't sync up and sometimes become quite out of whack. They still have the ability to get out of sync if you don't discontinue a pregnancy, you forget to document a miscarriage. So now what happens is if the parity numbers do not match the documented pregnancy history, there will be a warning, and the numbers will be highlighted in yellow, and the auto-calculation will be disabled until this is reconciled. So it now gives you some capabilities to be able to correct the problem or find the problem before you are digging into it with something you don't notice. If the G's and P's are documented properly, you will see the auto-calculation is correct, and you'll see the green check mark. That's just really the ability to let you know if you're experiencing a problem. And for those of you who deal with it, it was pretty challenging. The postpartum visit was further expanded to be able to take into consideration your postpartum check, give your weight status, any counseling that's needed, and basically from the postpartum HPI, there are now the expanded documentation options, which are at the bottom, where you can get into the postpartum depression, domestic violence, any counseling that you're doing, and this is just added another area. Now, moving out of the specialties and just other miscellaneous capabilities within KBM 8311, my custom plan now includes new features to reduce the number of clicks, and I cannot tell you, having played with it, how much it reduces the clicks. For those of you who understood the My plan and have used it, and I'm sure you have, anyone on this call at some level, it was a lot of clicks and a lot of functionality and a lot of setup. So now it basically gives you an example. You can bypass order module processing. You can incorporate new ask on order entry functionality. There's an info icon next to the AOE button. There's a defaulted billing type of patient if no insurance is attached to the chart. Another area is the pre-visit planning template. For those of you who are participating in patient-centered medical home or just want to use this functionality to ease the documentation of the providers, you now enable the providers to gather medical history before an appointment. Many of you have those pre-visit huddles. This actually helps you to get your patients ready to be seen. If there's any past medical history that you want to do, any services that they need to have, any tests that they're due for based on your pre-visit planning, you can now get that all set up and queued up. And now you have the ability to manage follow-up plans better. You can capture and maintain detailed record of patients' follow-up plans by showing the required amount of contacts and documentation needed based on the type of follow-up plan. So now we'll move on to some of the regulatory enhancements, and for this I'm going to hand it back to Lindsay. She can take us through those, and then we'll wrap it up with what do you need to do next. Lindsay, take it away.
Perfect. Thanks, Cindy. All right, I think we can all agree there's been a huge push lately for EHR systems to meet different regulatory requirements that keep coming out and keep changing. So as we start this new year, we are on a brand new quality reporting program under MACRA, and NextGen has started to deliver on their promise of keeping up with provider needs and actually helping them meet those regulatory requirements and allowing providers to maintain compliance. So if we start by looking at the EHR, NextGen has listed out each of these changes and identified them as positive modifications for providers to meet different measures. So the EHR will actually allow providers to cancel and change ARX messages to be sent, show patients' prescription fill information from pharmacies in the EHR, allow two-way communication with state-controlled medication databases, enable immunization forecasting from registries, allow corrected lab and diagnostic results to be sent to the patient portal, enable two-factor authentication, and finally allow clinical decision support for radiology orders. So all of these correlate to some measure currently reported on under MIPS and will hopefully ease the reporting burden put on providers to some degree. And then next we have the KBM, which contributes to better reporting by providing better workflow for referrals and transitions of care, new templates and data points for care plans, health surveys, and care team for CCDAs, updated data points for cancer and public health registries, clarification for ACI reporting when staff orders lab, radiology, and medications, new or updated clinical quality measures, or CQMs, not yet released from CMS, which will be used in quality reporting this year, clinical decision support, so adding references for order sets, and then the ability to mark patient education items sent electronically. So if you're familiar with the MIPS program under MACRA, you are mentally checking off how each one of these better supports either a quality measure or an advancing care information measure, such as HIE, patient-specific education, or registry reporting. And I think these will definitely be an advantage to providers when reporting. So I think that wraps up our regulatory section here, and I will turn it back over to Cindy, who will walk you through some of these considerations and best practices for starting this upgrade process. Cindy, whenever you're ready.
All right, thank you. All right, let's take just a couple minutes on the upgrade process itself, what you have to do and how you need to move forward. So the first thing we recommend is that these are big upgrades, particularly depending on where you're coming from. If you have not gone to UD2 at this stage and you're going all the way to UD3, from UD1, or this is a big upgrade. There's a lot of changes, a lot of things that need to be done and things that need to be considered. Not all of the features are mandatory, but there are some features in here that I think everybody is really going to want to use. So the first thing you need to consider is that you have to have a setup team, file maintenance, system practice templates, etc., that need to be reconfigured. The providers and clinical staff, you need to determine and understand the changes that will impact their workflow. Management training of the new features and enhancements will be necessary for all clinical users depending upon what you deploy. And because of the fact that you're talking UD3, the front office staff need to determine and understand the changes that will impact check-in and billing. Remember, there's a lot of functionality and things that need to change in that environment as well. If you want to plan an upgrade to 5.8 UD3, you can open a case with NextGen with the following information. If you're one of our clients or a reseller client, you can open a ticket with us as well. Or if you're a client of another reseller, you can open a ticket with them. At any rate, at some point you will have to let someone know that this is something you want to consider. If it's with NextGen, you will need to tell them the category is product maintenance, the topic is an upgrade, the subtopic is core, and the description is 5.8 UD3 upgrade. Once this is completed, you'll be assigned an account manager, and they will contact you. And that's going to apply whether it's NextGen Direct or iTentive, because we will let your account manager, or in our case, the relationship manager, reach out to you. The core upgrade also includes ancillary products. This gets forgotten sometimes, and you want to make sure that you remember that Rosetta is going to have to be upgraded, and that means interfaces and all of those things have to be tested as well. So you want to allot for that as you're planning. Upgrading to KBM 8.3.11 is pretty much the same thing. You're going to open a case, a category product maintenance, upgrade, KBM 8.3.11. Once you've done this, you will also get an account manager assigned. There's a single case. Now, if you're going to do both at the same time, and I've got more and more people expressing the desire to do that, because these are coming together and they're getting a little confident, and that's the direction NextGen is going anyway. So if you're going to do this, you no longer have to upgrade multiple cases for the same upgrade. You can make the same technical resource for both upgrades, prod, and test, and that way you can just apply and request these at the same time and get them scheduled at the same time. So if you're uncertain where your practice stands, iTentive can help by assessing your current readiness, providing recommendations on equipment, on processes, anything you do, and we can help you with the implementation of new processes and procedures. If you're heavily customized, you're going to have to do some gap analysis and work through that, and we have some experience and items that we can help you with that as well. So what are your next steps? You can visit us at iTentive.com. You can sign up for our webinars and blogs. You can consider one of our 3-day price-fixed on-site consultations, and we're going to be coming out with more of those in the near future. But for right now, clinical workflow, revenue cycle, technology, and performance, we're also going to be adding MACRA fixed-price opportunities. And then finally, you can test our products that Chelsea mentioned in her introduction. So for now, let's just move on and talk about questions, and we'll get to that.
Thanks, Cindy, and thank you, Lindsay. That was a lot of information there, and I'm sure that a lot of you listening are feeling a little overwhelmed. So again, you can type any questions you have in the questions area of the webinar control panel, and we're just going to answer them in the order that they came. Okay, first question. Can the specialty templates be accessed from family practice? For example, my family practice providers want to stay in the family practice templates, but they want to access the cool dermatology templates that you showed, or the ortho fracture template. Can that happen?
Oh, this is Adam Boron from iTentive. Yes, you can access these. You just have to change a couple of the configurations around to get to them.
Okay, great. Thank you, Adam. Next question, EPM question. Can we select the encounter rendering physician on filter 2 by NPI instead of name? If you have several physicians with similar names, some of the reports are difficult to differentiate.
We are working on that question. So I appreciate, first of all,
I think that Lindsay
go ahead.
Answers.
Yeah, I
okay,
actually,
great.
that was actually one of our questions asked at our previous showing of this webinar, and we were able to go ahead and test that, figure that out. Unfortunately, we don't have that capability right now. I'm not sure if NextGen's looking into it or if you'd want to bring that up to them, but as of right now, you can't filter by provider name, unfortunately.
Thanks, Lindsay. Next question.
It was NPI. I just want to clarify. It was. Can we filter by NPI?
Correct.
Oh, then no, sorry, you cannot filter by NPI. You can't filter by provider name. Sorry, I'm getting confused over here.
That's okay. I just wanted to clarify because I'm confusing myself sometimes too.
Okay.
There's a lot of filters out there.
So many. Next question. We have an ophthalmologist starting soon, and we wanted to put 8311 in before UD3. According to NextGen, that is okay if we're on the latest hotfix. Will that work out with the ophthalmology templates? Do we need UD3 as well?
I've got that one. You do not need UD3. You do need UD2. So I'm not sure, if NextGen made you aware of that or if you're already on UD2. We're pretty familiar with that one, simply because of the fact that our client upgraded to KBM 8311 before going to UD3. So that's that one I'm absolutely certain about.
Great, thank you, Cindy. Next question: Can the patient merge exemption be undone if it was set as an error?
Yes, it can be.
Great, thank you, Adam. Immunization reconciliation. We have an outbound HL7 interface to our state registry. Do we need an inbound interface to use the new immunization reconcile features?
I can grab that one. My understanding is no, although I think we want to research that and check into it. Do any of you others, Lindsay or Adam, do you know? For sure.
Unfortunately, not offhand.
Yeah, I've not heard of another interface being required. Again, we can look into that further, but I believe it's just based off current functionality. It's just going from that bi-directional communication to now allowing both ways. Yeah.
The majority of the immunization registries are handled within G-Share or some of the other services and HIU groups that are out there, so there's a lot of different variables on that. If you want to actually send which state you're in, that might even help us answer that question, but we could track that down for you to be sure.
Thank you, guys. Next question. In regards to that feature that allows users to add an NDC to the library at the time of charge posting, are the user rights features prevent users from using this feature?
I can go ahead and grab that one. We did just recently look this up to make sure. In System Admin, yes, you would actually select the group you wish to prevent from adding NDC codes. Then you would go under the Rights tab. And then you would look under File Maintenance, and there's an NDC library option. And you actually want to uncheck Update. And that will actually have users not be allowed to add NDC codes to the library from charge entry, and they'll actually get an error message if they try and do so while in the application.
Great, thank you, Lindsay. Next question. When do the numbers update in the workflow tabs to indicate how many of each you have?
Yes, I can take that one. So you can either set your inbox to auto-refresh every minute or 2 hours, however often you want it to, or anytime that you close the inbox and reopen the inbox, it would update those numbers.
Okay, great, thanks. And it looks like this may be our last question. What do the patient portal icons designate? This was on the slide before the KBM 8311 slide. Adam, can you take that one?
Yes, I can take that one as well. So there are 5 different icons. One of them is that the patient is enrolled. The second one, or one of them means, So one of them is they are enrolled. One of them means that they're not enrolled. One of the icons is pending enrollment. The fourth icon is portal account is actually locked. And then the last icon was that the patient declined access to the portal.
Great, thank you, Adam. Well, if you have any other questions that occur to you, please feel free to reach out to either Lindsay or Cindy. Their information is on the screen right now. I'll be sending out a copy of the presentation and a link to the recording later this week, so you can always reply back to that with questions. Or you can follow us on social media. We do weekly tech tips and other assorted next-gen facts and information, and you can always reach out to us there for questions as well. Anyone have anything else to add?
I just thank you all for attending. We really appreciate it, and good luck upgrading. I can tell you we really recommend it. I genuinely think you're going to be so pleased. We all know how scary it is. I don't think you have to be afraid of this one.
Great, thank you. And thank you everyone for attending, and we look forward to sharing more information with you in the future.
Have a great day.
Thanks.